What are the signs and differences between vitamin D and B12 deficiency? Before we dive in, this video is for general information only and isn't a substitute for personalized medical advice. If you have any concerns about your health, please speak to your GP or pharmacist. Are you getting enough vitamin D and B12? These are two vitamins that are commonly low in people across the UK. And many people don't realise there's a problem until symptoms have already set in. Both are essential for your health, but they work in very different ways, and knowing the difference really matters. Let's start with vitamin D. It's a fat-soluble vitamin, which means your body can actually make it when your skin is exposed to UVB sunlight. Once produced or absorbed, it goes through a conversion process in the liver and kidneys before becoming the active form your body can use. Its primary role is regulating calcium and phosphate metabolism, which is fundamental for bone health. Vitamin D receptors are found in many tissues throughout the body, and research suggests it may play a role in immune function too, though the clinical evidence beyond bone health is still being investigated. Vitamin B12 is quite different. It's water-soluble, and unlike vitamin D, your body cannot make it at all. You have to get it entirely from your diet, mainly from animal products like meat, fish, eggs, and dairy. Absorption is also more complex than you might expect. B12 requires a protein called intrinsic factor, produced in the stomach, to be properly absorbed in the small intestine. This is why certain conditions affecting the gut or stomach can interfere with B12 levels, even when dietary intake seems adequate. Your body can store B12 for several years, so deficiency often develops gradually and can go unnoticed for some time. B12 is essential for DNA synthesis, red blood cell formation, and neurological function. Getting enough of it isn't just about energy, it's about protecting your nervous system. Now, who is most at risk? In the UK, vitamin D deficiency is particularly common during autumn and winter, when UVB sunlight levels are too low for the skin to produce it effectively. UK guidance advises that many people should consider taking a vitamin D supplement during these months, and certain groups may benefit from supplementing year-round. Your GP or pharmacist can advise on what's appropriate for you. For B12, risk is higher in people who follow a vegan or vegetarian diet, older adults, people with conditions affecting stomach acid or gut absorption, and those taking metformin long-term. The MHRA advises that long-term metformin use can impair B12 absorption, so if that applies to you, your doctor should be monitoring your levels. Symptoms of vitamin D deficiency can include fatigue, bone pain, muscle weakness, and low mood. B12 deficiency can cause fatigue and weakness too, but it also has some more specific warning signs, things like tingling or numbness in the hands and feet, memory difficulties, and changes in mood or cognition. Importantly, B12 deficiency left untreated can cause irreversible neurological damage, including peripheral neuropathy and a serious condition called subacute combined degeneration of the spinal cord. That's why early identification really does matter, because the symptoms of both deficiencies can overlap, and because other conditions can cause similar symptoms, testing is important before assuming you're deficient. Current guidance suggests testing should be targeted based on your symptoms, risk factors, or any conditions that might affect absorption, rather than done routinely without a clinical reason. If you're concerned, here's what to discuss with your doctor or pharmacist: whether testing is appropriate for you and what form of supplementation, if any, is right for your situation. Always follow the advice of your healthcare professional rather than self-prescribing. If you experience persistent numbness or tingling, significant fatigue, difficulty with balance or coordination, breathlessness, chest pain, or any neurological changes, don't wait. Contact your doctor promptly. So to recap, vitamin D and B12 are both essential, but they work differently, come from different sources, and carry different risks if you're deficient. If you're unsure about your levels, speak to a healthcare professional. They can help you work out whether testing or supplementation is right for you. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information.